you end up having very seriously supported structure.
That is correct.
Yeah?
Yes.
So our approach to back pain rehabilitation and prehabilitation is to create that kind of structure. How do we do it? It's probably not a good thing to do it right now. We're going to talk maybe a little bit more of the details of hows and whys, but it's important to understand the concept before you learn how to do that.
Absolutely. Yeah? And like the other approaches that are used by not diminishing and by not taking credit away, medication, as far as the functionality of that structure, it's not going to do anything. I'm sorry. It will mask the pain. It will take the symptoms out of the equation. But as far as maintaining those joints, which every vertebra is a joint, strong and stable, it can't do anything, obviously, because the factor has been taken out of the picture.
I think sometimes pain medication might be necessary.
Of course.
Yeah. But it's definitely not a solution for long term.
It's just an option.
It's an option.
And it's up to the patient whether they want to take the option or not.
Exactly.
Obviously, when people are in pain, they can change their mind quickly because it's a huge motivator.
Exactly.
What happens is that if you're in pain, it's almost impossible to activate muscles because the pain itself will shut it down. So you might need to take certain medications to alleviate the pain so you can get those muscles to function and then see yourself, pulling out of the situation.
I think one thing is important to say is anytime you encounter a corrective exercise specialist, so somebody who's specialized from an exercise point of view, rehabilitation of back pain, that we're not medical professionals.
No, we're not.
We truly don't deal with a medical issue.
No,
we don't deal with a problem per se lower back.
Nope.
We deal with that creating a balance. Even though when we talk about food, when we talk about your lifestyle, we ultimately work with the balancing the structure.
Right, and as a matter of fact, if we feel that the situation is precarious, we refer them out.
Exactly. So a lot of times we work with medical practitioners, and hopefully at some point we're going to have some of them, we'll interview them. Yeah?
So
we work with the chiropractors, medical doctors, all kinds of different practitioners with very specific things. So a lot of times we work like a quarterback works on the team. We get a client, we do our assessment, we send them one place, another place, third place, and we try to work the team together to make sure our clients achieve the best result.
And it's very important to have a multidisciplinary approach to more than one issue.
Exactly. Ultimately, we learn that the more you work with people, the more complex the problems can be. And then you cannot have a solution for every single problem yourself. So there's other solutions that other people have different pieces of the puzzle. So we don't feel like it is ethical just to do it ourselves without referring people out.
Totally.
Yeah.
And as far as the prehab work, as we like to call it, we don't have to consult with any doctors because there's no existing condition. So all we're doing is kind of bulletproofing that person so they're not going to suffer from any back pain unless there is a trauma, like I said before.
I think it's a good thing to give our viewers a little test and see if they can figure out if the abdominal wall works or not.
Go right ahead.
Yeah. So one of the best tests you can do is you put your one finger on your belly button, and when you lean forward, you just want to observe your belly button.
Right.
If it pops out...
1 second. Let's do it in stages so they don't get the result test before they do it. So like Aram said, put your belly button, put your finger in your belly button, and lean forward like to touch your toes, for example.
Okay.
You can bend your knees or not. It's up to you if you have the flexibility. And experience what has happened. Whether the belly button went out, it pushed out, it actually went in, it drew in. Right? You have that answer already? Good. Now we'll tell you what both of them simply mean. So
ultimately when you draw your belly button in, automatically when you lean forward you have pretty functional abdominal wall, and chances are your core musculature listens to you automatically.
Knows how to react.
And knows how to react. If the belly button pops out, chances are there is some sort of issue going on.
Good. And let me go one step back.
Okay.
It's not that the belly button is poking out. It's that the abdominal wall pushes out.
Pushes out.
Because
Exactly.
they might actually have the fingers
Just
in the belly
slide,
button, and the belly button itself is not popping out.
Okay.
Like a turkey, for dinner. And so you're just looking to see what your abdominal wall does. Does it draw in, or does it push out?
Exactly. It's just a simple test that you can do on your own, just if you're curious enough to see if your abdominal wall is operating properly now.
Correct.
Do you have anything else for this?
Nothing else for these people today.
Guys, excellent to have this podcast, video cast running for this long. We promise to bring you a whole lot more fun episodes. If you have a back pain, don't delay with the help. There's a help out there. Find the right practitioners, call us, make a comment, ask us a question. If you didn't understand something, just write it down. We'll be able to explain. Yeah.
We have a huge network of other practitioners that do fantastic work, and we'll be more than happy to refer you to any of them.
Yeah, it's not only in US, the UK, Australia, all over the world. Yes.
Absolutely.
Thanks a lot. We'll talk to you soon.
Take care.